So in our first two sections, we have seen about the basic pathogenesis into the congestive heart failure, and then what are the drug used and the mechanism of action of digoxin. Now we'll discuss the general thing about the different type of drug. So this is the pathogenesis. Now what is the pathogenesis? We are talking about the reduced cardiac output is a congestive heart failure. So what is the reason behind this reduced cardiac output? If the myocardial inadequacy, that means contraction is disturbed, then cardiac output it will reduce. Ventricular dilation, if there is a ventricular dilation, so again cardiac output it will be reduced. If increase independence to the ventricular outflow, clear, independence to the ventricular outflow. Now how it is coming? First is volume expansion. Volume expansion means in the blood volume level is increasing, so it will cause the ventricular dilation, but not in the primary stage but later stage, when it will be happening for the continuous stage. Increase stroke volume, of course into stroke volume initially but not into the later, that's why the ventricular dilation we have wrote the later. Whenever there is a reduced cardiac output for a long time, it will cause the compensatory mechanism. It will cause the compensatory mechanism as a result volume expansion it will be there. Again, this is when it will be continuous for a long time. Then sympathetic stimulation, this will result to the ventricular remodeling. Again, ventricular remodeling means, again you can say that it will be a long term problem, and it is that's why I told that when there is a ventricular remodeling, it is very difficult for the patient. And ventricular dilation for a longer time, it will cause the ventricular remodeling. Next is renin-angiotensin system activation. Aldosterone again it is responsible for the volume expansion as well as the ventricular remodeling. Next is renin-angiotensin system activation, again the ventricular remodeling and increased systemic vascular resistance. So it will cause the increased systemic vascular resistance. If this increased systemic vascular resistance, it will cause the increased impedance to the ventricular outflow. It will also cause the reduced cardiac output. Now what is the drug? We have told about the different drug, how they are going to use. So digital is already we have told, they are increasing the cardiac output by increasing the myocardial contractility. Vasodilators, that is it will inhibit the ventricular dilation. Diuretic, it will reduce the volume. Clear? It will increase the urine outflow, so it will increase the blood, reduce the blood volume. Next is beta blocker. Beta blocker, it will act on the sympathetic stimulation and it will stop the ventricular remodeling. AC inhibitor as well as the AT1 receptor blocker or angiotensin receptor blocker, which is ARB. It is you can say that it is inhibiting the effect of the you can say that renin-angiotensin activation, that means aldosterone, and thereby affect spironolactone. There is directly affecting the blocking the effect of the aldosterone here and here. And arteriolar dilators, it will going to affect in this particular position. So these are the different drugs which is act on the different segment of the congestive heart failure pathogenesis, and they are going to helpful. Now despite of this advance into the medicine, management of the heart failure, which is usually present as disease syndrome, have been challenged to the healthcare provider. Why we are talking about the disease syndrome? Because here again you can see that reduced output, it will also, you can say that due to this reduced output, compensatory mechanism and ventricular remodeling, it will be the ultimately it will happen. So it is represent a disease syndrome has been challenged to the healthcare provider. So still it is a big issue. Beta blocker, AC inhibitor, cardiac glycoside, diuretics are the key medication used into the managing the congestive heart failure through regulating the renal function or the sympathetic nervous system or the directly acting on the heart. So recent important advance into the therapy includes use of combined diuretic therapy, a better understanding of the value of the digitalis glycoside, and evidence that ACE inhibitor that can relieve the symptoms and prolong life. So diuretic therapy, use of the ACE inhibitor for the prolonged use, that will be the better, giving the better result. More intensive therapy earlier in the course of the congestive heart failure appear to have some clinical benefit, and use of the ACE inhibitor during this phase may delay the progression and underlying ventricular dysfunction. Dysfunction, again, as we are telling, that it is responsible for the ventricular modeling. So beta blocker, diuretic, ACE inhibitor, digitalis, so these are the drugs are useful to treatment of the congestive heart failure and progression of the congestive heart failure. So this is all about the drugs used into the congestive heart failure.